Hi, everybody. Welcome to the Social Justice Research Seminar. Today I have the distinct pleasure of introducing myself. Um, so, yeah, I didn't wrangle somebody else to do an introduction for myself, but I'll just sort of say, for those of you who don't know me, I'm Eric Rice. I'm a professor here in the School of Social Work. I'm also recently the Associate Dean for Research and have been trying to organize us to have this research seminar series, which has been well attended, which has been nice. And today I'm going to be talking about social work and AI and the case of race equity and housing prioritization. Here, let me start my timer. As I have said other times when I've introduced others in this for these talks, the format of this is going to be I will speak for about 20 minutes and then leave us with a good 20 minutes or so to have a conversation. So if you've got a quick clarifying question, feel free to jump in and interrupt me, but otherwise I'll got about 20 minutes worth of stuff to share with you and some thoughts, and hopefully we can have a nice conversation about it afterwards. Okay, let's see. So first thing to tell you, some of you have seen me. Mahal, unfortunately, you've seen this talk recently, so you're in for a repeat. I just saw you show up on the screen, so you've seen pretty much the same thing before. But I like to remind people that even though I started this Center for AI in Society several years ago, I'm still very much an analog kind of guy. When I prepare for my talks, this is what it looks like. It's my pen with my notebook. And this is my turntable with my cat sleeping on the receiver because I like records. I'm an analog kind of guy. So if one of the things that you were fearing in this was that there was going to be a lot of talk about technology and maybe even math, I guess you're in luck because there's not going to be that much talk about it. It's more about the application of these ideas. There are other spaces and places, especially where my computer science colleagues present this work, where they really talk about the mechanics of how the AI works, but I talk more about the community. Interested in, I guess I was presenting this to a group at one point, a version of this talk last spring, and they were a little bit disappointed that I wasn't going to get quite so deep into the technology. So if you're looking for the technology piece of it, I can direct you to some of the work, but this is mostly going to be about the other part of it. So what am I going to do? Quick overview. Vision of interdisciplinary work using AI, the role of social science and community in this work, and then once I go through this example of the work that I've done on housing prioritization, I'll talk a little bit about some of the lessons learned in the context of this particular work. So as I mentioned, I started a center called the Center for AI in Society back in 2016, and the mission of the center is to bring together social work scientists and computer scientists and community to think about how we can leverage AI to tackle challenging social problems. A lot of our work focuses on homelessness. A lot of our work also focuses on health and well-being, and we also have a sustainability angle of things, which is a little less social work heavy, but we also have a very heavy emphasis on the human impact of climate change issues in that portfolio. But what I'm going to talk about today is homelessness and race equity. So in Los Angeles, as probably many of you know, we have a very extreme problem of homelessness. There are about 75,000 people experiencing homelessness. There was a slight downturn last year. I think the 2024 numbers are a little bit better, but it's been high and remained high for quite some time. One of the issues within this context is race equity, or the lack thereof, right? So what we see is that 9% of the population of Los Angeles is Black, but 30% of people who experience unstable housing or homelessness in Los Angeles are Black. The good news is that when you look at how resources have been allocated historically in Los Angeles, there has been a relatively equitable distribution of housing resources, at least as far as permanent supportive housing, which is a housing first model for those of you who know something about this space. It's a time unlimited housing with support services, and you don't have to be sober. You don't have to have mental health treatment under control. You can just enter into housing without those precursors. And the distribution of those housing resources, as you can see in terms of the population who received permanent support housing versus the homeless population at the time that this report was done, it was a few years earlier than currently, and the proportion of Latinos have gone up, the proportion of Black individuals in the population has gone down slightly, but the proportional issue here, you can see that there's a relatively equitable distribution. One of the concerns, however, has been, though, that perhaps people aren't receiving always the best resources or the most effective resources, in part because we're seeing that the rates of returns to homelessness are about double for folks who are Black. And they are also higher for Hispanic and Latinx folks, not quite half, but about half, as well of what you see for Black folks. So Black folks are experiencing more difficulties once they're placed into these housing resources. So one of the issues that has been raised is the way that housing resources are prioritized part of the problem in this race equity puzzle? So there are tools there are these assessment tools. The most commonly used one is called the VI-SPDAT, and it is a point system. It's a series of 35 questions that are asked as an assessment. It's akin to like a depression inventory or something like this, but it's a list of things which are supposed to characterize vulnerability. And then you get a score from 1 to 17, and depending on how high you score, you are prioritized. Now, I think it's important to think about what does this mean. I like to make the analogy between homelessness services and emergency rooms, right? No one approaches homelessness services unless they are in crisis. No one goes to an emergency room unless you have a crisis. But not everyone who shows up at the emergency room is going to die in the next 10 minutes. Some people show up with a broken arm. They can sit there in pain for several hours while you wait for the person that's going to potentially bleed to death or is having trouble breathing, who might die in the next few minutes. What is happening with these tools and why they were built was as an attempt to get around either the first come, first serve approach to giving housing out, or giving housing to people who seemed to be the worthy poor. There's some older literature which would suggest that those were the two most commonly used modes prior to these tools coming into play. These tools were meant to assign some sense of vulnerability on some objective criterion that would then allow us to know who should go to the front of the list and get served first. The challenge, however, has been that many communities, including Los Angeles, have felt that in the application of these tools, Black people in particular were not being placed at the head of the list at the same rates that others were. So you saw historically that we've actually done a decent job in LA, but that doesn't mean necessarily that everything's going well. So I was lucky enough to win a grant that was funded by the Conrad and Hilton Foundation and United Way, and working with the Los Angeles Housing Service Authority as my partner to look into redesigning those tools from a machine learning AI perspective, thinking about race equity and making sure that these tools could be equitable. So the first thing that's important to understand is that as soon as you start to do this kind of work, you really have to work with the people impacted. This is a social work value of mine. So when I say you have to do this, it's not really an imperative. One could do this work without it. I just don't think one should. And the first thing that we did was we created two groups that were our ongoing advisory boards. One was a community advisory board made up of people with lived experience of homelessness and people who were providers. It was about 20 individuals, and we met with them about 20 times over the course of the 3 years. We also had a group that we called the Core Planning Group, which was a group of policymakers at LAHSA and some of the other agencies that work with people experiencing homelessness in LA, such as the Department of Mental Health, to meet with them. And that was, again, a group that we met with about 20 times. And there was about 15 or so people in that body. And what we wanted to do when first off with this group was really involve them throughout the process of assessing, evaluating, and then redesigning these assessment tools to try to make it an objective but racially unbiased tool that could help us to prioritize people for housing resources. What we found, one of our first tasks was to say, well, if this thing is supposed to say that you're vulnerable, the question is vulnerable to what? And in order to anchor a predictive risk model, which is what this technology in AI is referred to as a predictive risk tool. You've maybe heard the idea of predictive analytics. These are things where we're basically, especially when you use longitudinal data, you can look at a certain set of data at one time point, and you can try to make some guesses about what's going to happen at a later time point. So here, what we did was we worked with the community. We said, well, if we're going to define vulnerability, we actually need to define vulnerability. Like vulnerability is an abstract concept, and it needed to be something that could be actually identified with the data. So we had some options and some constraints. What we could think about was returns to homelessness, time homeless, jails, deaths, hospitalizations, and psychiatric holds, because these were all things that we could track over time with administrative data. The Community Advisory Board and the Core Planning Group came back with the answer that they liked the idea of defining vulnerability as bad things that could happen to you aside from homelessness if you weren't actually given resources, that a tool ought to be good at predicting these sorts of things like jail, hospitalization, death, psychiatric holds, if you didn't get a housing resource. And so what we found when we first did this work was that the false negative rates, which is if you think about going to get a COVID test, if you will go to get a COVID test and you find out that you're negative, but you're actually positive, right? So then you're going to go back and get everybody in your family sick, right? So a false negative can be a big deal. In this case, a false negative translates into you're actually vulnerable to these bad things happening to you, but the tool's missing you, okay? So this is the worst kind of miss that we could have. And we asked of the data, is this something that is happening at equivalent rates across the population? And the answer was no. In fact, Native Hawaiians and other Pacific Islanders and Black individuals, in particular, those two groups, had the worst false negative rates relative to whites. So what we wanted to do when we were designing this new tool was to, through machine learning algorithms, look at the data available to us, which we had about 40 questions in this assessment. And we retained the questions that helped us explain vulnerability, and we reweighted them to give us a new scoring metric, no longer this 1 to 17 scoring metric, but a new scoring system. And we placed the constraint on this modeling exercise that the false negative rate needed to be equivalent across groups. So one of the things so then when we did this, then you can see here that we have essentially like less than 1% difference after we do this, which is not statistically significant. And this is a dramatic improvement in the equivalence of this. And what we found when we did this was that some of the items that were in this original battery were retained and some of them weren't. So then we went to the process of, we reduced the questions and rescored them. Then we went back to the Community Advisory Board and said, okay, these are the questions that we need to keep in order to understand vulnerability, but are these questions actually phrased in a way that is trauma-informed and in a way that is with race equity in mind, so that people from different racial groups, if they were to experience these questions, they would feel comfortable answering these questions to potentially somebody who's of a different racial or ethnic group than they are asking the questions, which often happens. And also just are these confusing. Some of these questions, if you read them, they're like, it's survey, research methods 101 fail. It's like they're triple barreled questions, like, are you this, or this kind of thing? So we needed to do a bunch of rewriting, but we, the team, didn't want to rewrite these questions. We wanted the community to rewrite these questions. So our Community Advisory Board, this group made up of these providers and people with lived experiences, actually took the 19 questions that the data science said we needed, and then they rewrote them to address the the manner in which those questions were asked. And we also worked extensively on some how the process of the tool administration worked in this as well. So one other issue, and I'll just mention it briefly before I start to share some of what happened when we piloted this study, is that it's not just the questions that you keep or not. It's not just the weights that you give to them. It's not even the wording of the questions that always matters, but it's also the process of a human being interacting with another human being, asking these questions of one another. You can imagine if it's the first time that you meet somebody and they look very different from you, you may not trust that they understand where you're coming from. And especially this was, the case when we think about how there's a disproportionate number of Black men who experience homelessness, but there's the case workers who work in homelessness services are disproportionately not Black men typically. So, there's a way in which we need to think about how do you create processes which build sympathy, empathy, and trust. So we also worked with this community advisory board and a number of other providers that we did qualitative interviews with to explore over time what had worked well and what had worked badly in the delivery of these tools historically to create new recommendations and processes, which we then pilot tested. So we finally did a pilot test. It's a relatively small pilot test. And although I will give you a spoiler alert about this talk, which is that this tool that we developed is being implemented as of next year in LA Housing Service Authority. I've been in conversations with them about what they're doing to get ready to implement this new tool. So they were happy with the work that we did and the pilot's findings. The pilot findings were really about how well does this, not so much how well does this new scoring system work, because that's not something that you can easily test without actually putting, many people into housing with this, but it's more, are the questions that we reworded, are they working well? Is the new process for tool administration, is that working well? And then we're going to have to check in over time to see if in fact some of the equity issues that were of a concern seem to be ameliorated to a certain extent over time. But here are the organizations we worked with on this pilot test. And we had 18 different case managers who worked with us. They had 49 total clients. We asked them to administer this tool with somebody who had already been given the VI SPDAT previously. That's the old tool, because we wanted to ask the clients how this compared to the older tool, and we also didn't want to confuse clients that this pilot test was somehow going to lead them to get resources when in fact it was a pilot study, right? And then we did client satisfaction interviews with all of the clients that took this pilot, and we did open-ended interviews with the providers. And overall, the results of this were very positive. So when we looked at the client experiences, people felt like they were treated with respect, like they understood what was being asked of them, that they felt comfortable with the person who was doing the interview. So some of these issues around process of the trust were really well taken care of with these folks. Also, we asked if people were actually engaging with the clients around some of the things that we wanted to implement into this process. So part of it, we wanted people to stop and pause after sensitive questions and check in with clients, not just rush them through the next thing. We wanted to make sure that it was explained to clients the importance of answering honestly. We wanted them to, make sure that they explained how this information was going to be used and what its purpose was. We also wanted them to actually ask, hey, are you comfortable with me administering this survey? And all of these are new parts of our process that are supposed to be built in. And the clients, for the most part, said, yes, these new things had been done. Got a minute left, but that's okay. I've got 2 more slides I want to share. So I won't, the main topics that came up in the tool interviews with the providers are here. I want to share 2 quotes before I stop. One is about the process of checking in. So the case managers commented that they liked the option about offering breaks. it's like a question like, are you okay to move forward? And what I noticed was the participants sit there, think about it, and they'd be like, no, I'm okay. So this was something that seems to be working the way that we had hoped it would. Also, when asking about some of the more sensitive questions and providing more of a preamble about how those questions are going to be used and the reminders of confidentiality, et cetera. Said, I really love the fact that we made it clear that whatever their answer was, it wasn't going to harm them. I felt like it allowed them to relax a little bit about the questions, especially around the chemical dependency or substance use. Honestly, what I really liked about this, I feel these questions were just like an equitable approach to asking potentially difficult questions. It had been raised over and over and over again, that especially when working with Black and Latinx clients that, yep, I understand, 20 minutes, that we case managers were concerned that the people from those communities where there was high stigma, especially when talking to case managers who might not be from your community, that you might be perceived as somehow you would be stigmatized, you'd be punished, resources would be withheld from you if you disclosed, especially about substance use and incarceration. And some of those questions are key part of the metric, right? Some of these vulnerability questions. So I'll just kind of wrap up with saying, one of the things that really needs to be thought about when we're doing this work is just how to get everybody to start talking together about something so complicated, right? An enormous amount of data science complexity is going on, but also there's an enormous amount of community service delivery provision complexity that's going on. The people that are experts in the one area are not experts in the other, and bringing those people together to talk together in meaningful ways takes time and is a challenge, but it's also very much possible. But it's really a matter of kind of balancing, community needs also with your research needs. And so that, I think I will stop. Thank you all for listening, and I will open the floor to questions. And here's some references if you want to read more. So I know I talk fast.
Maybe they're all kind of small interrelated questions. So you put up a slide about false negatives.
Yeah.
And I'm assuming the false negatives were based on the things that you had shown on the prior slide, the jails, hospitalizations,
that's right,
et cetera. And it sounded like you used machine learning to, so I guess my first question is, was there anything learned about why some questions were leading to false negatives? And the other part of that is, can you give a specific example of how being better at that might lead to somebody getting different resources?
Sure.
That might end up producing a better outcome?
Yeah, that's a great question. So I think Mike speaks well enough to be heard, but the question is really about, is there something that we learned from the data science about false negatives, and then as we retooled the model, something about why there might be more equity as we did some of this rescoring, essentially. And so what one of the things that we found was, so in general, the implication of a false negative is that you need resources, but those resources are being withheld from you. So exactly the sort of race inequity bias that the community had said to us they thought might be happening was actually happening when we looked at the data. So we were able to, one of the things that we were able to do is we were able to come back to community members and say, I know that LA has done a decent job of allocating in equitable ways, but you've still been concerned that these tools are actually not capturing, especially Black clients' vulnerability in appropriate ways. And you are right that the error rate is like almost 6% worse than it is for everybody else, which is like one person out of 20 more is scored improperly, which is a big deal when you're talking about, at a level of population. Okay. So what did we learn from this? So one of the things that we learned was we used a technique that's called a lasso regression. So it's a lot like regression models. It's actually, ironically, it's the thing that you're taught not to do in graduate school in the 90s, which is a thing called backwards and forward step regression model. So basically, like you enter into the regression, you could use all the data available to you. Which are the variables that actually turn out to be important? This is actually a very popular technique within machine learning. When you're thinking about all that you care about is what is the data here that predicts the outcome here? Which of these data points do we need, and how accurate can we make the model? Not necessarily how theoretically rigorous can we make the model. And what we found was that when we retooled it, there were certain items that needed to be given more higher weights than had ever been done previously. So in the old system, essentially across these 35 questions, you usually got a point per bad thing that happened to you. And sometimes there would be one of 3 or 4 things that could lead to the answer of 1 point. But never was it the case that a particular experience is very important and might give you, say, 3 or 4 or 5 points. One of the things that we found when we did the retooling to make it more equitable was that substance using behaviors wasn't necessarily something that needed a whole lot of retooling, even though it was something that was very much a concern in the community. Jail time, though, was. You actually get 3 points, not 1 point, if you have a history of incarceration. So a history of incarceration was really important for predicting subsequent negative experiences. We also know that incarceration is disproportionately something that impacts communities of color. So it wasn't intuitively to me, when I saw those results, I thought, oh, this is part of what's happening, is that there are some issues that are disproportionately impacting communities of color that are being treated as equally important as issues that are not disproportionately impacting them. And in fact, if you weight a little bit higher issues that disproportionately impact those communities, even though you're not giving anybody any points for being Black or Latinx, you're giving people points for things that happen more frequently when you're Black or Latinx. And so it is in this sense, it is fair from a legal housing equity standpoint, but you're also acknowledging there are systemic differences in how people are treated. Now, if it turns out that LA stops being racially biased in how it polices, this will then change over time. But given that if LA continues to, people in Los Angeles, people of color continue to experience incarceration at differential rates, this will probably continue to be there. So I think that is part of how the math helped us adjust for what had previously been a problem, but we could then subsequently say, if we do it this way, now our error rates go way down. Thanks for asking me a question to let me talk about the math.
I wasn't trying to do that.
I know. Are there questions on online? Anyone? I know I throw data science and race equity out there, so it's like nobody wants to talk about either one of these things because they both seem like they're. Well, okay. How about more in?
Well, this could be a very amateur question, but
I love it. There's no such thing as a bad question.
But I just want to continue on that train of thought that we see this dispositional factor that basically the inequity in terms of policing cost for DEH on the street. And they have experienced that. Is there anything we can do in terms of the intervention side to adjust for it? Because if I think about survey itself, if you adjust for it using different weight, that kind of just manipulate the result a bit, not necessarily solving the problem itself, right?
So there's 2 problems that this thing does not solve. There's many problems that this does not solve, actually. Let me rephrase that. Working on this issue has been challenging in a few senses. One is people often mistake the race and equity issues that are happening in homelessness with the race and equity issues that might happen in the provision of services, right? So people will say, we're really upset about the fact, and understandably so, that there's this disproportionate number of Black individuals experiencing homelessness relative to the population. Like 30% of the people who are experiencing or on the streets tonight are Black, and only 9% of the population of LA. Like, that's not right. You know, those are often driven much more by structural factors in the economy, the way that the policing around the war on drugs in particular, a myriad of other factors, right? And not necessarily anything to do with how LA allocates housing resources whatsoever. So that's a challenge. And no matter what you do with these tools, you are not stemming the tide of who's coming into homelessness. This will not solve affordable housing. This will not solve structural racism in the way in which people are disproportionately evicted or policed, right? It's all of those things will continue unabated no matter what you do with these tools. All that these tools can do is say that if we have a value, which housing and urban development has this value and is sort of passed down to communities, that you ought to serve the most vulnerable, therefore, in their eyes, the most need, those in most need, before you serve those who are less vulnerable with the limited housing resources you have, because there's not enough housing to go around. You ought to then these tools try to address who goes to the front of the line, and we're trying to make sure that it's not reinforcing or creating new sources of racial bias that further exacerbate inequities. The challenge there that I've really struggled with is that working on this project has made me in some ways by default, sort of an advocate for these tools as opposed to an advocate for more housing, right? And I think that these tools are a stopgap measure. It's a Band-Aid for what you do when you don't have enough housing resources to go around, right? So we've got 75,000 people on the streets, but LA Housing Service Authority houses, I don't know, 15 or 20,000, Ben probably knows the number better than me, folks in permanent supportive housing interventions in the course of a year. So there's a gap between the supply and the demand. And so we're always in this scarcity model where we're saying, well, some people are going to get this and some people aren't.
Stop.
What's that?
Right
I guess that wasn't that something else.
now, not meeting.
He'll give it to me. I feel like Ben keeps much better track of these things than I do, which I probably should when I'm keeping a public talk about it. But the bottom line is there's not enough to go around, and we make decisions about who gets it, and that means people don't get potentially life-saving resources, right? We're talking about, when people don't get housing, they end up with these bad things like hospitalizations, incarceration, and even death. And that's the consequence of living out on the streets long term. And the research is very clear. The longer you're out there, the more these bad things happen to you, the worse your health is, the more likely you are to have premature mortality, horrible stuff. And so, I'm kind of in the business, unfortunately, inadvertently, of supporting, sort of justifying a scarcity model. And I don't actually feel that's what my political opinion is. What I think we should be doing is building a lot more housing resources, not just trying to figure out how to, dole out what limited ones we have. But at the same time, this is the reality that we live in. And so I want to make sure that that reality isn't making things yet more inequitable. So I get involved in this thing that I feel like, well, I'm making a bad situation a little less bad, but it's not making a solution that's one that I really want to see happen. And so I had a lot of existential crises during the pandemic, which maybe was spurred in part by the pandemic, was spurred also in part by working on this project during the pandemic about what is this all about, and is this even something that we should be doing? And ultimately the answer was yes, we should be doing this because we need to stop race and equity in places where we can, and this is a place where we can. But it's not a perfect solution to the problem, which is a fundamental problem of lack of resources and affordable housing. Oh, good. So how can similar prediction models address homelessness amongst veterans geographically? So the cool thing about veteran homelessness is that this is actually a place where we do have almost sufficient resources, right? So here, I don't know that we necessarily I mean, maybe it's more an issue of trying to do some homelessness prevention prediction models. So this is another project that my colleagues at UCLA that helped me with the data science piece that I just shared here have been working on, which is also a data mining project where instead of looking at who's going to have these hospitalizations, et cetera, you're looking at who's going to enter the homelessness services system, looking at some of the records from other systems like hospital records, mental health records, et cetera, and trying to identify prior to people experiencing homelessness, people who might be likely to experience homelessness in the near future, and then directing prevention resources, because sometimes it's easier to have people maintain an apartment than it is to, once they've lost it, to get it back. And that kind of predictive model, I think, could actually be really potentially powerful for addressing some of the veteran issues. Also, there are just a lot of veterans on the streets, right? So we may, although I don't know that there is the same sort of scarcity of resources issue where we're trying to figure out who gets put to the front of the line so much as there seems to have been a lot more resources mobilized to serve that particular population, but to the extent that you could again look at data to try to help with this.
There was one more
question
up in the chain. That just
see.
got hit by.
I am going to maybe I'll stop my sharing for a minute and then I can actually see the comments. Okay, thank you. How can similar? What administrative data did we use? Oh, we were using LA County's homeless management information system data, which had been linked by the California Policy Lab, which is at UCLA, with administrative records from LA County Hospital and mental health and jail and death index records. So when we were looking at the outcomes of these models, it was actually concrete, sort of objective, recorded and administrative records, not a person indicating that, oh, well, I was in. We have questions about have you ever experienced jail time, but then we're also looking subsequently at were you incarcerated. Transition from jail to shown to be successful in preventing homelessness. Right. So I think what we were not surprised to see that incarceration was one of the key problems here, indicating people's inability to transition out of incarceration is a major cause of homelessness, and it is also a major reason why people have trouble resolving their homelessness. So we definitely need to be thinking about more interventions and just giving people a few more points to get them on the permanent supportive housing. Like, that's a start, but that is far from enough. I think that we need to have more interventions targeting that particular group of clients in our caseload, because I think that there are certain interventions that, depending on the funding source, that people with especially felony records have trouble getting access to certain resources because of legal restrictions. And so we need to be kind of creative about how we address the formerly incarcerated population in getting them interventions. I hope I got the questions. I think I did. Raphael, go ahead.
One of the things that I didn't see, and perhaps you did mention it in terms of one of the predictive points for data sets, are those who have been in foster care in some way, shape, or form. There's just always, 50% of those who leave foster care end up homeless.
Yeah.
So I wonder if you can just talk a little bit about that.
Sure. So this particular analysis was done for what's referred to as the single adult homelessness provision service group. My recollection of the questions in that index is that it does not ask about foster care involvement. There is a specific youth version of a vulnerability tool that I actually helped build out several years ago, It's designed for 18 to 24-year-olds, and their foster care experiences are part of what's there. We have not yet done a similar process with LA County's youth data. We've done some proof of concept models with some data that we got access to from a third-party collaborator of ours that had HMISS data from that was de-identified and anonymized from about 16 cities that they've been working with. And we were able to do some of this modeling like this for youth there. And they're, definitely your foster care history is part of the process of what gets modeled. But so that's a long way of saying not here, but it's a really relevant issue, especially for youth. And the housing services is broken into 3 different categories of service provision in Los Angeles and across the nation. There's a family housing, which is usually a parent and some children. There are youth housing, which is 18 to 24-year-olds, and then there's single adult housing, which is for individual people who get a place on their own. And each of those systems has a slightly different vulnerability tool that needs to be properly interrogated and tweaked in this way. But the concerns around equity that LA expressed were much louder about the single adult system than it was about the youth or the family system. Those people have some grievances with those tools as well, but they're just not as loud.
So it's the BI SPDAT,
Yeah.
and I just out of curiosity, does it have to be used in a particular form? Like, do you have to ask the questions in it? Because I hear you talking about changing the questions.
Right.
Is it required that the ask?
So this was part of the process, right? So unlike a psychometric measure where the wording is really important, here it's often events. Did a thing like this happen to you or not? So it's a little bit less of like when you're thinking about a depression measure. Do you feel blue, or how many of the last few days do you feel? Have you been feeling down or depressed? And it's validated in this very specific way. Here, it's much more about a checklist of events, and people don't necessarily understand or what the wording of the questions meant. But we've also thought about, and we have a whole line of research that's about what happens when you change the wording of these questions, and therefore the distribution of those data moving forward might shift. How do you design your algorithms to potentially account for, while what could be in the long run, better, more accurate data that's different from what you have now? And that gets really above my pay grade really fast. But the point that you're bringing up is a really, it's like a very concrete in some ways for us as social science researchers. We can think about, you're going to change the questions. That changes the reliability potentially, it changes the validity potentially, what's going to happen. And then what my data science folks thought about was, let's model that there's going to be some noise and try to use that as part of how we build this out, which I thought was a really kind of clever way of, instead of waiting for more data 5 years from now and saying, okay, let's do it again, saying, let's try to model this as potentially some shifts. And they were even thinking about, if we change this and people from different groups might answer differently than they did in the past, do we have any sense of who might answer in what ways, and can we try to fit that into it? And which also got to be a little bit of kind of guessing, but it's also informed guessing.
But what I hear is that there's no federal prohibition on making some minor adjustments to clarify items.
Correct.
Okay.
And moreover, the group that originally designed the VI SPDAT, which is a group that came out of Canada, they in 2020, in the midst of this project and a couple of other projects there was a project that was going on in Allegheny County that had a head start to us in doing a similar thing. And then the folks in Canada saw some of their preliminary results, had some conversations with us about some of our preliminary results. And they were very unhappy with how people were administering the tool in practice. And so they actually put out a sort of a press release saying, we're no longer standing behind this tool. We think the community should really do things locally to figure out how to make these sorts of things better for themselves. we understand that there's issues. We were trying to do the best that we could, but new things need to come into play. So there's been, which has been interesting because communities have felt like this gives them license to get creative, but it's also left a lot of anxiety about, okay, if we don't have a sort of standard accepted tool anymore, what are we supposed to do? And the thing that's happening in Allegheny County can't necessarily be replicated in other places because of the way that their data is integrated in real time on a daily basis. And even our tool, we're suggesting, this works in LA, but we can't guarantee that it's going to be the same for other communities. So I will end with, because it's 12:45, just two last comments. One is, it's really exciting to know that this is actually going to be put into practice in LA. I'm also nervous about that because, I know that there's also potentially, it will not necessarily be, fixing all the problems that people would like to see addressed around race equity issues in Los Angeles. And, this is only one small piece of that. And then the other thing is, please come and join us again next week when we will have more conversation. And if anyone wants to stick around for a couple more minutes, I have a few minutes before I need to go to my class. So thanks for your attention.